month where somebody's gonna be like, oh my God, we don't have parking spaces. Come on.
I hope I get the parking 660 all the way.
Oh no, our parking spaces have been pushed, even the ones we had that were better, like we had some towards the front. Those are being pushed further back as construction is disrupting other parking spaces. So at this point, you should just be grateful we have spots that are numbered, because
They're on the way, I guess.
it doesn't look that.
But you know, it's like,
So, but no, all of them are getting pushed even
I
further.
don't want to say they're a little cheap, but
Send us as well.
That's so funny. Phillips.
Stuart Alabama first, right?
Very briefly, yeah.
You know the funny thing about all that?
Just legislative
It
relief.
was nothing for us to
Hold on, who's that? Thinking all this.
go out and shoot a
Especially considering it. I did, it's well
on
done.
LSU.
He's already covered his stuff.
the punt.
First day was when they passed that motion. So, a real,
Just in case you need it blocks it for the
good
option.
introduction.
Or whatever.
It could be a good way. Transfer the little three-quarter and stuff.
I used to always get that to my house, now I get that.
Why don't you just double what you're gonna lose that?
What you want?
Just double what you're gonna lose.
That's what they're doing with partnerships.
You know, but back in like,
Work for Americans.
but they're like in jail for like a while and they let them go.
Right.
Then they re-arrest them. We found the video.
How are you today?
Thank you for being here.
Hope the mic's not on.
Good afternoon, and thank you for being here today. I'm joined as usual by Dr. Cantor. He will be speaking to you in just a few minutes with an update. We've got a couple of announcements to make today that I believe are rather exciting and our path through this pandemic. I can tell you just at the outset that we're obviously doing better. There are some reasons for concern, but overall we're in a much better place. I do want to start, however, by addressing the weather that we experienced yesterday across the state of Louisiana. And in fact, it was felt all across the southeast portion of the country. Overall, we fared very well considering the forecast and the likelihood of very severe weather with damaging winds and possible strong long-track tornadoes. There were a couple of possible tornadoes in Union and Washington parishes. The National Weather Service is working to confirm those tornadoes. There was a total of 5 homes that received major damage. Tarps and other resources are being supplied by local emergency responders. No parish has declared a disaster, and no parish has requested assistance from the state. Most importantly, we have learned of no injuries or fatalities, and so that's obviously a very good thing. So we feel very blessed today that it wasn't worse than it was, because it had every potential to be. Shifting to our COVID-19 update, the first announcement I'm making today is that as of Monday, we're going to expand vaccine eligibility to include all essential workers in Priority Group 1B, Tier 2. And this is regardless of their age, regardless of their underlying health conditions, except that you have to be at least 16 years old. I'm going to quickly go through the list. It'll be up here for you to see as well. But this includes higher education faculty and staff, food and agricultural workers, food service workers, so restaurants, bars, hotel workers and other hospitality workers, judiciary personnel. So that's clerks of court and their staff, DAs and their staff, judges and their staff, public defenders and their staff, and court advocates such as CASA and others. Postal workers will be included, manufacturing workers, grocery store workers, transportation workers, bus drivers and so forth. And that also includes river pilots, water and wastewater workers, energy workers, bank tellers, construction workers, clergy, IT and communication workers, media workers, public safety engineers, and other similarly situated workers, public health workers, frontline government workers, child, youth, family service workers, veterinarians and support staff, waste management workers, public and private security and emergency preparedness workers. So those individuals have been added to the list. Their eligibility starts on Monday. Like previous workers who were eligible by virtue of their occupation, they will schedule appointments just like anyone else. They will identify themselves as an eligible worker, and then when they show up for the vaccine, they will need to present an ID badge, a pay stub, a letter from their employer, something that evidences the fact that they work in these occupations that make them eligible. This change obviously applies to everyone 16 years and older who works in these areas. Remember that Pfizer is the only vaccine that is approved under the EUAs that have been authorized for 16 and 17-year-olds. I realize that many people in the groups that I just listed are already eligible due to having one or more underlying health conditions that the CDC has identified as making them more vulnerable to the disease and in a high-risk category. Our strategy in Louisiana has been to vaccinate our most high-risk populations first in order to preserve hospital capacity and protect those most likely to have a severe outcome from COVID. And certainly, foremost among our objectives was to minimize the death associated with this terrible disease. We are seeing some encouraging trends when it comes to hospitalizations and percent positivity. I will tell you the number of deaths we're reporting every day is stubbornly high, and I am looking forward to that decreasing and ultimately being able to report 0 deaths. That won't be today, however. We do know that people in the previously mentioned key sectors are more likely to be exposed to COVID due to their profession, and many have not had the option of being able to work from home because they were essential front-facing workers. Those individuals have carried our state through these most trying times, and we want to make sure that they have the opportunity to get the vaccine if, in fact, they are not already eligible. I will tell you that I believe this will be the last expansion of eligibility that we're going to make before we open it up to the general public, meaning the only move that I can see at the moment going forward into the future will be to say everybody in Louisiana who's 16 and older who wants to have the vaccine and hasn't had it yet, you're now eligible. We're not making that announcement today. And I'm not sure when we will get there, but it's pretty clear to us that that will be the next expansion of eligibility. We know, and you know, that President Biden has established a goal of opening up eligibility to all adults by the start of May. I do believe we will beat that goal in terms of getting there sooner. I just don't know exactly when. But based on the allocation of doses that we've been told to expect over the coming weeks, we don't think that the doses available will be a limiting factor, and so it will simply be a factor of when we detect slack in the system that we have for appointments and for the administration of the vaccines. Again, the expansion that I just mentioned to these essential workers who've been added to the eligibility list, they go into effect on Monday. We, as I mentioned, are continuing to see encouraging trends with our numbers related to COVID-19. Today, we are reporting 558 new cases on 21,996 new tests. Sadly, we're also reporting 19 new deaths for a total of 9,974. So we're just 26 deaths short of 10,000 in just over a year that we've been in this pandemic. Currently, we have 414 people hospitalized. That is down 32 from the number that we reported yesterday. 67 of those hospitalized individuals are on mechanical ventilators, and that is up 1 from yesterday. Statewide percent positivity is 2.9%, so just a little below 3%. That's the lowest it's been since the start of the pandemic. Hospitalizations are the lowest that they've been since late March of 2020, so almost a year. And I don't know if you remember, but they kind of slowly went up to 500, and then within a couple of days they were at 1,500. Today we are just above 400 is what we're reporting. I do want to thank everybody who's working so hard on all elements of COVID-19. And by the way, testing continues. Vaccinations obviously continue. There's an awful lot of work going on. And we have a lot of good partners, both in the public sector and the private sector. The work being done out of the Department of Health and the Office of Public Health has been tremendous. And one example of the fruits of that is that Louisiana is leading the nation currently in people who get their second dose on time, which is important. But I also think that this is a testament to the hard work of our vaccine providers and how much the people in Louisiana really want to get back to normal and to protect themselves and their families, their friends, their coworkers, and even strangers that they don't know. More than 500,000 people have completed their COVID vaccinations, which is more than the total number of people with confirmed COVID cases. So these are good trends. They're great trends, actually. However, we remain at a critical stage in our response, and this is best evidenced by pointing out that there are at least 14 states currently going in the wrong direction in terms of their positivity, their cases, and their hospitalizations. There is growing evidence that this is due to the variants of the virus out there and to some other factors as well. Thankfully, we haven't seen these in Louisiana, but as we know, and we've seen for a year now, this pandemic has a mind of its own. This virus does, and it is very important for us to continue to do what we can to minimize the transmission, especially in light of the variants, while we do everything we can to speed the vaccinations. And so doing both of those things simultaneously is incredibly important. That's why we have to keep wearing a mask. We have to socially distance, follow the mitigation the measures that we know work, and certainly we have to get the vaccine when we are eligible. I am happy to report that as of 2 days ago, I am fully vaccinated, meaning I'm 2 weeks past my second shot of Pfizer. And people are fully vaccinated per the CDC when they're 2 weeks past their last shot. So whether it's the second shot of Pfizer, the second shot of Moderna, or the single shot of Johnson & Johnson. And like many other Louisianans, one of the things that I look forward to the most, and I think I'll get this opportunity on Saturday, is having a nice visit with my 85-year-old mother. So that for the first time in well over a year, we can hug, take our mask off, enjoy a meal together, and have a really good visit. And I mention that because this is just one of those things that returns us to a semblance of normalcy. And it's something that was relatively minor in our lives. I mean, it's always special to be with your mother, and I'm not minimizing that.